Hi, I'm Chris Little. I'm the news director at KFI AM 640, and today we're talking with Dr. Ben Miller. He is the Chief Strategy Officer with Wellbeing Trust, and we're talking about the complexities of healthcare and mental health policy and strategies. He's also a self-proclaimed fragmentation fighter. We'll find out what that is in a moment. And he has worked to redefine the national policy landscape for mental health and healthcare. Sounds like a lot of complicated stuff. So
Just a little bit.
thanks for coming in, Dr. Miller. I appreciate it. And first of all, what is a Wellbeing Trust?
Great question. Good place to start. Wellbeing Trust is a national foundation focused on advancing the mental, social, and spiritual health of the nation. So kind of like your lead, it's a little complex. It's something that we know is going to require a lot of time and attention, but it's what we want to focus on.
And Wellbeing Trust was created by Providence St. Joseph Health.
It was a lot of insight from leaders within the health system to say, you know what, we've got a problem with mental health and substance use. What can we do to address that? So they started Wellbeing Trust, gave us a generous gift, and here we are.
How did you get involved in mental health policy?
That's a great question too. So I came by this naturally. My grandparents one was a physician, one was a politician. And so when you're raised in an environment where you're always talking about politics and healthcare, you're just bound to be a psychologist. I think that's what it means. And so I grew up where we always talked about the intricacies of community, of health, and policy. So it was never just like, hey, what do you think about, politics and healthcare? It was like, how do you combine them together? And so I came into this where I worked in a school for special education. And there were children in there that they would come to school and they hadn't had a shower in 3 days. And so they couldn't focus on what they were actually trying to study because they were worried about, well, do I smell, or how uncomfortable am I? And so we would address those issues in the school, but there was a broader system issue that was going along there, and it was around policy, where the families couldn't afford their house, the mom and dad couldn't get a job, and so the kids were coming to school and they were the ones suffering. That's how I fell in love with policy.
So you started out as a school counselor?
I was a special education teacher, which is horrifying if you think about me as an educator. But yeah, that's what I did for 2 years.
And what is a fragmentation fighter?
Okay, so I like to think of myself as a punk rocker. I grew up playing music in garages with the doors down. It's part of the reason I can't hear anything now. And so that mindset...
Join the club.
Yeah, right. That mindset goes into my work today with policy. So fragmentation fighting is essentially recognizing what the biggest problem is in healthcare, which is that we've got fragmentation. So we treat pieces really well, but we don't treat the whole. So if you want to be a fragmentation fighter, then your goal and your solution is to integrate, and that's what we're working on.
And so how do you do it?
Well, how do you do it? Well, you begin by recognizing...
I know that's a simple question.
Well, thank you. How much time do we have? Yeah, I think it goes back to the recognition of the simple things, that mental health, the things that we could talk a lot about, it's not really that different from your overall health. Now, we've made it different, and we talk about it differently. Our language fails us because we say mind and body, but really it's just about your health. So the first thing that we can do to change that culture is just to use different language. Mental health is essential for health.
Mm-hmm. You've spoken a lot about the need to better integrate mental health with healthcare. In doing so, the ultimate goal is what?
Yeah, the ultimate goal is that you have a seamless experience when you're working in the healthcare system. So if you're an individual and you show up and you have a problem, there's a likelihood that you have more than one problem. So you might show up to your primary care doc and you say, you know what, I just don't feel so great.
Right.
And they do some blood work, they do whatever they do, and they say, okay, you know what, you actually have hypertension. But beyond that, we found that we think that you also have some symptoms consistent with depression. And so, Chris, rather than say, go see that psychiatrist, 6 months from now and talk about your depression, integration, the goal of it is to have those providers in the context of primary care or in healthcare so that you see everybody seamlessly.
Well, that doesn't happen a lot right now, does it?
A lot? It doesn't happen at all.
At all?
Yeah.
Okay.
I mean, we're trying to get it to happen more. You can find pockets of brilliance everywhere throughout the country, but unfortunately, it's still not the standard.
Shouldn't we be getting healthcare checkups the way we get, physicals or get our cholesterol checked?
Yeah. And it begins with conversations like this. I mean, one of the things that I think we've missed out on is that health is so intimate, it's so personal, that we have to be able to talk about it with each other. But sometimes because it is so personal, we don't want to talk about it. So we leave it to the professionals to say, oh, we'll go to healthcare for that. But really, it just begins like this. How you doing? How you feeling? How was work today? How's your home life? All that stuff, that goes a long way in addressing health.
Well, why has mental health care seemingly taken a back seat in healthcare? Maybe for some of the reasons you just mentioned, or what?
Yeah, I think a lot of it has to do with our history and our culture, where we historically treated mental health as so different. I mean, remember, we used to lock people up in hospitals and say, good luck,
Right.
because we didn't understand the science or how to treat them. And so that stigma, which is what we would define as difference plus deviance, it's a little nerdy, I understand.
Right.
But when you treat somebody different and you kind of separate them out, that's reinforcing the stigma. And so mental health, we've got this long history of really treating people different. I think a lot of folks think about that today. I don't want to be treated different. You don't want to be treated different.
No.
So if you bring it up, who knows?
Well, how long is it going to take, do you think, to change? Or I'm assuming it's changing now.
It's changing now because we're talking about it.
Yeah.
I mean, the mere fact that, the folks listening or watching, this is really about changing the narrative of health in this country so that it's not abnormal or strange to talk about mental health. It's actually a normal thing. Just as we would inquire about, well, how's your back doing? Well, how are you feeling? And literally be able to handle what happens when somebody says, not too good.
But what's taken so long for the medical community to become enlightened, if that's the right term?
It's the right term. I think a lot of it has to do with the business structures and the policies that have reinforced that separation between mental health and healthcare. Mm-hmm. It's not easy to make changes in healthcare because we've got a lot of structures that are in place that have been in that way for a long time. So as we talked about, mental health was historically separated. Right. So in 1963, when John F. Kennedy signed the first piece of federal legislation around mental health, he said we need to get people out of the hospitals and put them into community. So when those people went into community, unfortunately, the policy and the financing and some of our mindset, it didn't change that much.
Yeah, so I'm sure there's more than one, and we've talked about, I think we've led up to it, but why don't you share with me some of the successes you've had in mental health innovation? I'm assuming you've had a couple?
A couple, yeah. But let's start with small things. Mm-hmm. So I'll tell you a story. So I live in Colorado, and there's this beautiful valley called the San Luis Valley in Colorado. And one of my favorite stories recently has been a gentleman who owns a Mexican restaurant in the valley. And he realized that there was such problems in his community of people dying from opioids, dying from drug overdose,
right,
that he realized that the reason they were dying is because they weren't talking to each other. So literally on Tuesdays or whatever day it was, he would create these boxes and they would have questions and he would put them on the tabletops and he would get people to talk about the issues. They were all about mental health and addiction. So Chris, how are you feeling today? How are you managing your pain? Questions that really got to the heart of this issue that was plaguing that community. While that's a small thing, it's a tabletopper, mm-hmm. It literally is an innovation and a success. Now I can take you all the way to the other end of the spectrum. We could talk about massive policy and this amazing stuff that's happening now across the country where we're reinforcing some laws that really give us parity for mental health benefits. That's a technical term, mm-hmm. but it basically means that your mental health benefits are at the same level as your medical benefits. And we haven't seen that for close to 10 years. We're watching it happen now, even this week.
So I'm assuming, I'm going to restate what you just
Please,
said. Our mental health benefits are not the same as our healthcare benefits.
Yeah, so I went from tabletoppers to coverage. And
right.
So just to show you the complexity, absolutely. So when we separated out in 1963, go back to my history here,
right.
when we brought about mental health into the community, we actually created a separate benefit for mental health. There was no such thing as a mental health benefit before 1963.
Oh, I see, okay.
And so you basically had two benefits at the time. You had your mental health benefit and your medical benefit. And so that means that a health insurer could actually have a medical benefit that was more robust than your mental health benefit. Parity brings those to the same level. They allow for people when they're, let's just say a copay. If your copay is X number of dollars, it has to be the same for medical as it is for mental health. And that didn't happen until about 10 years ago. So it took our country from 1963 to 2008 to be able to figure that one out.
Why is it that a lot of insurance companies and even managed care, they only have a certain number of mental health visits you can have?
Right. Well, see, that would technically not be at parity.
Right.
Because, are they limiting your medical benefits? If they are, then chances are they have to be the same number. If they're not, then they are not necessarily within the law or enforcing parity. That's a bad thing.
Why is an hour session 50 minutes?
That's right. Well, it could be whatever you want. Let's talk for hours about this. But I think a lot of that has to do with the way that we finance healthcare. Mm-hmm. So on the medical side, typically if you go to see a primary care visit, they're billing out for 15 minutes. And not to get too far,
true, yeah.
Into the weeds here, but mental health requires a little bit more time. Now, it doesn't mean we need to spend an hour together because there's no evidence base for your time here. It's just really about what's the most effective thing for you and how can we provide the coverage to give you that.
No, just sidebar. What is a good amount of time to spend with somebody in therapy?
As much time as you need.
Well, that's a great. That's pretty philosophical.
Well,
How much time do people need?
Well, I think it comes down to what your goals
Generally.
are. I mean, what are your goals? So what we would
Right.
do traditionally is we would say things like, what is it that you want to work on? What's most important to you?
Mm-hmm.
And then we would assess, well, how confident are you in being able to do that goal? And then if you can accomplish that, and you may or may not need me, it really comes down to you. And that's the thing about kind of healthcare in general, is that the goals and what's most important should be the patient's or yours.
Mm-hmm. I think it's fascinating. We could talk about this all day long, but I want to keep talking about well-being trust and how does it help change and create policies?
Well, so Wellbeing Trust is a national foundation. We're, a 501c3, so we're a nonprofit. And we really think about the role that we play in policy through kind of 4 L's. So I'm going to alliterate here for a second. I'm an academic, so I always use things like this. So we want to lead. We want to be out in front talking about these issues. We think that it's really critical as a foundation to raise the bar on what's expected for mental health. Second, we want to leverage. So we make investments. So we want to put resources into communities and allow for people to leverage the investments that we've made. So if you're in California and we create a tool, I'd love for it to be used in New York or Alabama or wherever. So we want to leverage our investments. The third is that we want to link. So we have a really wonderful network of people all over the country, amazing innovators that have some of the best ideas. How do I link them to other people throughout the country so they can advance mental health? And then fourth and last, probably most important, is localize. How do you take all this national strategy and really take it down to the level of community? Because just as we were talking about how change happens at an individual level, the most important thing that we can do is begin to target local communities and allow them to bring forward their own solutions.
So when you're making policy, or affecting policy change, does it start at the local level or the federal level?
Oh man, that's a wonderful question, and it really is both. And so here's the thing, is that policy is one of these ideas that we sometimes get confused around. So we define it really simple. It's movement in a direction for a reason. So you can think of it like this. Where are we? What is the issue that we're trying to deal with? Are we actually going in the right direction, or are we going in the wrong direction? And if the answer is we're going in the wrong direction, then you need policy to change whatever it is you're doing.
Well, is there some disagreement whether you're going in the right or the wrong direction?
Of course, but that's the fun of this. That's where politics come in.
Yeah.
And so yes, there's a lot of fun there, but policy is not as complicated as people make it sound. It's actually something that we should be talking about more, but people they equate it too much with politics and this ridiculously complex healthcare, and they just don't think about the local policies. Things like, do I have a speed bump on my street where the school is? Simple stuff.
Right. Is there a mental health, not policy, but what do I want to say, model in any state or any community that you look at and go, hey, that's the way to do it?
Well, if you could take pieces from all over the country and bring it together, you would have a nice hybrid of what I think excellence looks like. But unfortunately, we don't have that. We just got the pieces here and there. There's not one state that's just nailing it. I would say that any state that has a strategy to integrate mental health, bring it more into the fabric of healthcare, make it more easier for you and I to gain access to that. Those are good examples of what we should replicate.
Where's Wellbeing Trust focusing its policies and activities? I mean, I know you said lead, leverage, link, and localize. That's a lot of, but I'm sure it's other places as well.
Well, those are our 4 functions, and we actually want to address 3 things in policy. So I've got lots of lists.
Oh, wow.
We can do lists forever.
Write some more down.
Yeah, I'll write some more down. These are easy though. So we really want to focus on coverage, access, and standards. Okay, so coverage is what we already talked about with your health insurance. Do you have adequate coverage? Is it comprehensive enough so that when you go to wherever you go, you're going to be able to see who you need to see? That's the first one. The second one, though, is somewhat predicated on the first, which is, do you have access to an individual? So just because you have health insurance doesn't mean you're going to be able to get in and see a clinician when you want.
Right.
So how do we create more seamless access? So we're the places that people present. If you're in a school, if you're in primary care, if you're in a radio station, wherever, how are you able to increase the access in those places? And then third is around standards. Even if we had access and good coverage, you still want quality care, right? You don't just want to show up and have anybody see you and it be mediocre. But we tolerate mediocrity, and so how do we encourage the health system to do a better job on increasing the quality for mental health? Those are our big 3 policy areas.
Okay, and so that last question is, how do you encourage? How do you encourage?
Well, there's 2 answers to that. So there's the easy answer, which is that we try and financially incentivize people to do those things. Then there's the harder answer, which is we try and get folks all throughout the community, folks listening to your show, to come up and say, here's what we want, to demand for something different. If they do that, to me, that's how you bring about change. That's more of the grassroots. How do you get people in your communities to say, this is unacceptable what we've got, we want something different?
Are they doing that?
In some cases, yeah. In some cases, yes. I think what we find is that in local communities, in small communities, people are recognizing that issues around access and affordability are preeminent. They're number one on their list. And so they may not know what to do to fix those problems, but they know it's enough of a problem to raise it to the attention of the policymaker.
And where do people in the community feel, the mental health policy affecting their lives?
Probably most in their pocketbook or in their frustration and trying to find somebody to help them. And so really, if you look at most states, when we survey folks, we find that the number one and number two issues are around access and affordability. So let's hang out on access just for a second.
Okay.
So we know that last year, 96 million Americans had to wait more than 1 week to get access to a mental health clinician. Okay, so this to me is like one of those stats where you hear and you're just blown away. First of all, it's great that 96 million Americans are seeking out care, but it's unbelievably frustrating when you're in the middle of a crisis or you just want to talk to somebody and they say, just kidding, Chris, you're going to have to wait another week.
Wow, yeah.
That's unacceptable. So that's why it's number one on the list, because people want access. Number two is affordability. And in this day and age, it's a longer conversation for another show, but I mean, we're in a place right now where we are paying way too much for healthcare. 18% of our gross domestic product goes towards healthcare. This is trillions of dollars that we spend in healthcare, and yet people still can't afford it. There's something wrong and cruelly ironic there.
What percentage goes to mental health care?
Very little, but that's a whole nother conversation.
Yeah.
And so when we begin to think about the whole budget of healthcare, ideally it would be that mental health is just a part of that, but still mental health is treated as a subset.
How do you identify the need for mental health policy innovation?
Wow. Well, first of all, we listen. I mean, anybody that goes into a community and says, I think I know what's best for you is not the right person for you. So you got to be able to listen. Say, what are your needs? What are the issues that you want to address, community? And there's a lot of examples of this where communities say, you know what, like I just gave you, access and affordability. We want to do something. In my state of Colorado, we've had communities rise up and say, unacceptable, we can't get access. So what Denver, my city, did, we self-imposed a tax on us to put more money into the mental health system. So that's a way to have your voice heard, but it's also a way to address the issue.
There are some things that people and communities and companies can do to get involved in mental health policy innovation. What is that? It seems a little overwhelming.
It is overwhelming, but I think the most basic thing that people can do is to be aware of the issues. So number one, knowledge is power, right? If you are not aware of the problems that your community is facing, you're not going to be able to do anything about it. So talking to folks and learning a little bit about, well, what are the issues? That's number one. Know what your issues are. Number two is know who to talk to.
Yeah.
So depending on what level you might need to address the issues, is it the superintendent of the schools? Is it the governor of California? Who is it? Find out who that next person is that you need to talk to. And then number three, go talk to them. Bring forward a plan. We have elected officials in place for a reason. They are representing you. And if they're not able to meet with you or to listen to your concerns, well, that's a whole other separate topic. And again, a place that you can go for other action.
Who's out there in the community advocating for mental health?
Well, this should be every one of us. I mean, this should not be left to a community organizer just to say, okay, everybody that's had a mental health issue, raise your hand and let's get together and talk about what we're going to change. This should be every one of us. Because whether or not we realize it, mental health will impact us in our lifetime. It's inevitable. So mental health and addiction impacts everybody. We have these numbers that we use, like, one in some, however many, we actually say 1 in 5 usually, but that's a kind of it doesn't tell the whole story.
Right.
The whole story is that even if it's not you that's being impacted, it might be your family member who's got the issue. And then that's going to impact you or influence you. That's what we want to encourage. So when people bring forward ideas around mental health, talk about it with your friends, but then surface that up at the community level. You be your own organizer.
So I hear you saying that the community is talking about it, but it still seems like somebody is like trying to pull a stubborn mule across the desert when it comes to mental health. And a lot of those people are the people who need the help.
Yeah.
So you have to reach out to them and let them know maybe what they should be advocating for?
In some cases, yes.
You have to educate them as well.
Yeah, education is always a part, but it's not telling them, here's the solution, because it's letting them have their own solutions for what they think is best. I'll give you a couple of examples of this. So we found that last year alone, 151,000 people in the United States died for drug, alcohol, or suicide. Terrifying numbers. We looked at individual states, and in some states, those numbers are higher than other states. The community is well aware of this.
Right.
This is not something that the community is like, oh, I didn't know that was a problem.
Yeah, that's true.
They actually do know that there's a problem. They don't know what the solutions are, though, to your point. So what we do is we find places that they have ideas. Okay, well, if we want to figure out a way to better address mental health, in one community in New Mexico, they told me what they need is jobs. It's not the psychiatrist or the psychologist or the social worker. That's great, but we don't have employment. And so when we don't have employment, we feel despair.
Is there more despair these days and frustration, or or has it always been the same over the years, decades?
Because the trends show that we are dying more earlier. Life expectancy's decreased, for the last 3 years. That's unheard of in the United States.
I had no idea. No kidding.
Well, and I think it's to your point. It's because of these diseases and deaths of despair. So people are feeling more lonely and isolated, even though, ironically, we're more connected than we've ever been. So 1 in 6 people have reported being chronically lonely. That's a lot of people in the United States. So when you're lonely and you feel despair, sometimes, unfortunately, people, turn to other means to manage that pain and suffering. And it could be drug, alcohol, or in the worst case, suicide.
You've touched on it a little bit, but what are some of the challenges and solutions for, policy change for mental health?
Well, I think the most important thing, and we had touched on this just briefly, is around integration. So fragmentation at the onset we talked about is the problem, and so integration is the solution. How do we think about integration in policy, in financing, in delivery, in training? We didn't even talk about workforce. You got to have a workforce that's prepared to do this. How do we instill this notion of integration in a psychology program as you would a medical program? That's stuff that it's basic, but it's actually not done, so we should be doing it more often.
And where's the biggest need for mental health policy change?
Well, I think we talked about here, if people don't have affordable coverage, then they're not going to seek care. So if we don't start with the basics coverage, then unfortunately I'm afraid that it's a non-starter for all the other wonderful things that we've talked about. So what does the coverage look like? Who does it cover? What does it cover? All the good things that we would consider for health insurance. That's number one. Once we do that, I immediately want to go back and begin to talk about how to increase access. Find the places and the spaces that people show up and present, and then address their needs there.
Seems to me one of the places that could be a powerful place to get some help would be in the workforce. From employers supporting mental health, and is that happening?
It is, and we're seeing that increasingly happen where employers recognize that the number one reason that a lot of folks are showing up at work and not getting their job done is because of depression. So there's this thing called productivity, right? It's when we show up to our jobs and we want to be, getting everything done for our manager or for our boss. So employers recognize this, and rather than just say, oh, well, that's a problem, they are bringing on-site more help. So it could be education programs, it could be on-site clinicians, it could be wellness breaks every 2 hours in your office. It could be yoga in the break room. It could be any number of things.
I work for a big company, and it seems like it's taking a long time for that wave to spread across the workplace. Is it large companies, small companies, independent? What is it that this is working the best for?
Well, I think that's a great point.
Or working the most?
Yeah, the culture that we're still trying to change in our workplaces, our employers. Employers, they've always had this mandate, not always, but they've most recently had issues around, well, I want to give you health insurance, right? That was a competitive strategy to bring people into the workforce. Now, it's not just good enough to give you health insurance. We actually want to make sure that we provide a healthy work environment for you. So whether it's small or large, I think we're seeing small examples. I'll give you a great one here. So a small company in Georgia. Instead of like every Friday, they would have these breakouts where they would send people outside and go walk around. They started hosting this, what they would call tea time. And they would put tea in the middle of the room, and they would have folks stand around and just share what's going on in their life. So it wasn't just like, hey, everybody, you have to go outside and exercise. They would say, we wanted just you to connect to your friends and your colleagues. And they found that people were happier with their job. They found that, hey, that guy that I was working next to, I didn't think I liked, I actually do like. That improves so much in a workplace.
You said, I'm just going to read this. You said high quality care. You have said that high quality care means strong outcomes for all communities, not great outcomes for some communities, and poorer outcomes for others. I think that's fascinating. So how close are we to getting high quality health care?
Well, unfortunately, to that quote, we're pretty far away, because that speaks to the heart of equity, and that it's not one size fits all, that we are going to have to tailor strategies and solutions to local communities, and that's what I've been talking about the whole time. I think that we are seeing a movement towards more things that matter. Patient-reported outcomes is an example. So instead of just like looking at your blood pressure to see how well I'm doing manage your hypertension, I actually am going to ask you, hey, Chris, how am I doing managing your hypertension? That's a very different outcome.
Yeah.
And when we begin to change the dynamic and somewhat flatten the hierarchy in healthcare, I think that we'll start to get to some of that. But until we actually begin to focus on the people that really matter, which is you or the patient, I don't think we're going to get there.
I was reading something that I think you tweeted out, 44 million adults in the U.S. with mental health illness, but only more than half did not get treatment. Now, why is that? Is that equity? Is it, or they don't want to admit it, or what?
Well, a lot of it still has to do with the access. And so imagine that you're identified as having a mental health need. Okay, you show up to your primary care provider and they say, okay, Chris, we think that you might have symptoms consistent with depression. Now go see somebody. So like we talked about earlier, if you are told to go see somebody else, there's a couple things working against you. One, you got to figure out, how am I going to get there? How am I going to pay for it? How am I going to take off time from work?
Right.
But then there's this other big piece, which is like, what does that mean about me? And that stigma that we described about mental health in this culture, some people are not willing to admit that they might actually be depressed. They're just simply going to say, okay, you know what, I just had a bad day. But they're not going to embrace it. When you embrace it, you normalize it. But it's going to require us to get care, and a lot of people still don't seek it.
You've also said that poor mental health can shorten your life expectancy almost as much as certain chronic diseases, and as much as smoking or not working out.
Yeah.
Now, why is that?
Well, think about it. From a physiological perspective, if I stop doing the things that I used to do that brought me joy, I sit on the couch instead of get out and go for a walk with my friends. Or I stop eating healthy and I start eating the things that, I shouldn't be eating. Those things on a physical side, they really add up. And so your mental and your physical are so inextricably linked that we have to be able to look at not addressing mental health and how it's going to have a negative impact on your overall health.
Are there any partnerships that Wellbeing Trust has that are making a positive impact?
Yeah.
And what are those?
Sure, lots of partnerships. So I'll give you a couple from a high level policy to more of a clinical level. So at a policy level, we've partnered with a group called the United States of Care. And this is run by and started by the former CMS administrator, Andy Slavitt. And the United States of Care focuses on these issues around coverage that we've talked about. And so without the good coverage, again, you can't get access. And so they're focused on how do we increase our state's ability to find affordable coverage for individuals. So we've got a partnership with them where we not just talk about the coverage piece, we bring mental health into that. So that's one example. We've also got a partnership with the Institute for Health and Care Improvement, where we're looking at how do you go into emergency departments, these places that people go when they're in crisis, right? And how do you figure out a way to change the process or the structure for emergency departments so they do a better job with mental health? So they don't just isolate you and put you on in a back room and say, we'll deal with you later. They actually make sure that they address you adequately up front.
Wow, fascinating. It seems like you're very passionate about what you do.
Thank you.
And it takes a passionate guy with great-looking socks.
Thank you.
And
nice shoelaces
to get this done.
Yeah.
Thank you. Thanks again, Dr. Ben Miller.
Thanks, Chris.
Chief Strategy Officer with Wellbeing Trust, and we'll see you again next time.